Rabies is horrible.
Animal health expert Mohammed Espa explains a footage of the sad ending of a young man infected with rabies. The victim was bitten by a dog, according to the unidentified doctor in the clip, believed to originate from East Africa.
This is rabies like you've never seen before. With the permission of the patient's father,
at this stage, when a rabies victim displays clinical signs, medical authorities say they have almost 0% chance of surviving. All they need is palliative care, basically a treatment that helps ease their suffering while waiting their ultimate end, usually within days or at most weeks. This is how dangerous rabies is. A disease caused by a virus that is usually carried by some animals which transmit it to humans. Dogs, cats and bats are among these reservoir hosts. In Sierra Leone, dogs and cats are the predominant culprits.
Dog claim over 98% of people who are affected with rabies is as a result of dog bite. Okay. So it's a reservoir host in Sierra Leone and mostly in tropical region.
Mr. Ba is head of programs at the Sierra Leone Animal Welfare Society, a non-profit organization that seeks to protect the welfare of domesticated and wild animals. Over 40 decades since its discovery, rabies remains one of the world's scariest diseases, thanks to its high fatality rate. The risk of its transmission to humans is high because of our very close interaction with these common pets. Yet, we often pay little attention to the danger associated with them. Consequently, tens of thousands of people die from rabies annually. World Health Organization data show that about 60,000 deaths are recorded worldwide. In Sierra Leone, available data show that 3 out of 100,000 people die from the disease, which translates to 210 fatalities annually. Mr. Ba, who is also the secretary of the National Rabies Control Task Force, has been at the forefront of Sierra Leone's battle against this zoonotic disease. He believes that lack of coordinated data means that the true extent of the epidemic in the country is unknown, citing data suggesting increasing reports of animal bites across the country. Humans get in contact with the rabies virus either through animal bite or just the saliva of an infected animal. The time it takes from exposure to the appearance of symptoms is determined by the point of exposure in the victim, vis-à-vis the distance from the brain. Because of this, it can take between just a few weeks to months and even years before symptoms occur, which include weakness or discomfort, fever or headache. There also may be prickling or an itching sensation at the site of the bite. These symptoms can then progress to cerebral dysfunction, anxiety, confusion and agitation. As the disease further progresses, the victim may experience delirium, abnormal behavior, hallucinations, hydrophobia or fear of water, and insomnia. The acute period of the disease, as is the case of this boy restrained to his hospital bed, typically ends within 2 weeks.
It actually travels through the central nervous system to the brain. It is there it starts to manifest signs and replicate itself. So if you have been bitten from let's say the hind legs here, right, of your feet, it can take longer time. The incubation periods can take longer time compared to if you are bitten, say, around your shoulder or around the head part. Because the shorter the point of entry, because it is not only, we cannot only be infected through the bite. Even you can be infected through your nose, your eyes. Yes, if you happen to contact the virus and you play with your nose, you play with your eyes, you can be infected, even your mouth, because the virus is found in the saliva, right? So if you've been bitten here, or it happens that it enters through your nose, it's just few weeks. days, the signs can manifest themselves.
True.
So the length of the incubation period depend on the part of the body that the virus enters to that of the brain. So at times, if you've been bitten, say down here, your legs, it can take years, 1 or 2 years. So during that period, the sore must have been, you must have been forgotten about the sore. I mean, then this, after some time, the signs and the symptoms started to manifest themselves. They will attribute it to something else. That this is witchcraft. So these are cases that are not reported. These are cases that are not recorded. And it is also because of the knowledge, the low knowledge level about the disease, that many cases are not reported. But I believe, and it is a fact, that it is worse than what we have, 210 annually.
According to the U.S. Centers for Disease Control and Prevention, less than 20 cases of human survival from clinical rabies have been documented in history. While early diagnosis can prevent human death from rabies, in animals there is no coming back after being infected with the virus. And animals exhibit symptoms in slightly similar ways, including fearfulness, aggression, excessive drooling, difficulty swallowing, staggering, paralysis, and seizures. Experts say the best way to prevent the disease is therefore by preventing animal rabies through regular mass vaccination.
What we are doing, is more of preventive measures than curative. Because in humans, if a person is infected with rabies, for example, we would not be testing for rabies, but we would look at presumptive signs and symptoms of rabies that suggest rabies. And by the time these signs and symptoms show up, then it would have been very, very late. So what our best intervention actually is for us to make sure that we prevent rabies more so than having the person infected and then treat the person. We have gotten cases even in Sierra Leone of a child that was infected with rabies. The mother was taking the child to the hospital, and then the child was at the back of the mother, and the mother was beaten by the child, and the woman also died of rabies. So let's see, that's how serious it is.
But not only is this vaccine expensive, it is also very hard to come by. In Sierra Leone, it is available only in a few private pharmacies. Samuel Seri is a senior pharmacist and head of the Access and Availability Unit in the Directorate of Pharmaceutical Services in the Ministry of Health. His unit is responsible for quantifying medical commodities, including vaccines, before they are procured by the government through the appropriate institution. Seri joined the Directorate since 2015 after graduating from the College of Medicine and Allied Health Sciences. He says since then, he isn't aware of any procurement of rabies vaccine.
Since I started working in 2015 till date, because even my colleague that is working at API, we graduated together at College of Medicines. So she has been posted at API and I have been posted here. So ever since she took over at API, she said they have not procured the rabies vaccines. Because there was also another entity before that was doing procurement on behalf of government of Sierra Leone by the name of National Pharmaceutical Procurement Unit, NPPU. Because in some of their documents, we notice that most of the items that they have been quantifying and procuring at an earlier stage, you will notice that we have anti-rabies, anti-snake venom, all of those were part of the procurement list. Maybe by then they were procuring it, but ever since we started working, I don't know the reasons why, but it has not been procured.
Seri says his office was recently directed to quantify a host of medical commodities, including rabies vaccines, which are yet to be procured. The expanded program on immunization, which is responsible for procuring vaccines, didn't respond to my request for a comment. This state of affairs leaves majority of Sierra Leoneans at the mercy of the private sector providers. For an illustration of what this could mean for a family looking for the life-saving medication in Freetown, we traversed the Lumley area, one of the busiest business centers in the capital city. Between the Lumley Police Station and Juba Bridge, which has the largest concentration of businesses in the western part of the city, we counted 7 pharmacies, only one of which had the vaccine. The Sierra Leone government reportedly designated rabies as number 2 among its priority diseases in 2017. It is ranked immediately behind the hemorrhagic fever diseases. Since then, however, efforts in the response towards rabies has resulted in little impact. But according to Mr. Barr, a lot of work is being done behind the scene, citing ongoing review of the National Rabies Control Strategy. This strategy outlines Sierra Leone's roadmap to attaining the Sustainable Development Goals target of eliminating rabies by 2030. At the legislative level, he adds, 2 crucial legal documents, the Animal Health Model Bill and the Animal Welfare Protection Bill, have been approved by Cabinet and they have cruised through the Law Officers Department, heading for Parliament. Both instruments are crucial for animal welfare, which campaigners say is at the heart of effort to eliminate rabies. But with all these policy actions, adequate public awareness is key for the country to meet the SDG targets. Eliminating rabies will also require a serious rethink of sociocultural behavior, especially in relationship between animals and humans, says Thomas, stressing the urgent need to address the issue of Freetown stray dog population and how humans interact with their pets.
There are a lot of times when people, because of socio-cultural beliefs, they will think that if someone is bitten by a rabid dog, maybe that dog is bewitched or that person is not normal or something, and they would not even want to link it to the infection of rabies, so they would even think of certain things. They will say maybe this dog is sent by someone evil and all of these things. It has happened even in Sierra Leone. There is a case wherein a traditional healer was attacked because a dog actually beat someone, maybe a rabies dog, and they said this traditional healer actually sent this dog to actually bite that person. So they tried to even get rid of that person.
The tragic story of Suleiman Kabir illustrates how costly lack of awareness is with a disease like rabies. The life story of this Potloco native who died in 2017 is both inspiring and sad. Born in Mile 91 and hailing from a humble background, he struggled through hurdles to put himself to university. Suleiman was a Year 2 student at the Limkokwe University of Technology when he met his tragic ending at 24 years. He was jogging one morning when a stray dog came from nowhere and bit him on the back of his palm. Safia Gbori, a neighbor and a close friend of Suleiman's, recalls rushing him from one health facility to another in desperate effort to save his life from an illness he himself at the time knew very little about, despite his level of education and exposure to the medical world.
One morning, according to him, before he died, he told me that one morning he went out to jog around between 5 o'clock to 6 o'clock in the morning. Along the way, he was bitten by a dog right here at the back of his hand. He didn't do much about it because he didn't know what to do about it at that time. So all he did was to visit a friend who gave him, according to him, tetanus injection. And for them, because of the lack of information and knowledge about dog bite and the possibility of rabies and how that could be prevented, he and his friend thought the tetanus injection was enough to protect him from the dog bite and the consequences of rabies. So he never took any action until 6 months after, when he started feeling some signs from some kind of tingling around the areas where he was bitten. And one morning, around 7 o'clock in the morning, I was rushing to work when he came to my house. He was a neighbor. We were just living in the same neighborhood. He came to my house saying that he's not feeling well. He's getting this tingling. And I said, what's causing the tingling? Why are you complaining and pointing to the back of your hand? That was when he told me he was bitten by a dog. So he was concerned that he was getting that kind of feeling and the tingling sign. At that time, without knowing, but at that time he had already read a little bit about dog bites and what happens if you develop rabies. So he was concerned, very seriously concerned. I could see that he was concerned, but at the time myself, I didn't know much about rabies. So I only treated it as the ordinary kind of malaise, like you're feeling sick, you're not feeling well, and things like that.
Safia would take Sulaiman to the 34 military hospital, then the emergency hospital, and finally to Connaught Hospital, where the sad news was given to them.
We arrived at Connaught around 6:30, 7 o'clock that evening, and we were advised, we were told that the clinical signs of rabies had already started, and it is probably too late. So with that, and I could see the fear in him when the health worker, the doctor we met on duty, when the doctor told us that it is probably too late, I could see the fear in his eyes. And I also knew then at that time that after discussing with the doctor that it was really too late.
At this point, Safia took a photo of himself and his dying friend. Safia is still traumatized by the sight of how his dear friend's life ended.
What I saw and the way I saw him die traumatized me for a whole year. Imagine somebody dying and shouting and crying and being very convulsive and shouting at the loudest voice of a mature man continuously for several hours, over 6-7 hours, continuously fighting, like, and this was impulsive. It's not necessarily that he didn't know what to do, it's the sort of state of mind he was in, and he was fighting continuously and groaning in pain continuously for several hours. And what I saw traumatized me for over 1 year, because in the process of trying to restrain him, and he was bleeding from where he was given where the health workers tried to give him a drip, some injection and all of that. He was bleeding a bit, and in this process of also trying to restrain him, I sustained a little scratch, even though I managed to use sanitizer at that time, being conscious of hospital-acquired infection and things like that. But the fact that he later died of rabies, and the fact that I later learned so much about rabies and what can cause it, and the incubation period. Remember, I got exposed to his blood, got direct contact with his blood, not just me, but his brother as well, his cousin. The fact that I also sustained a scratch from him during the struggle, and later learning that the incubation period of the virus can go up to 6 months or up to probably up to 1 year. That traumatized me for a very long time. Even though I got the vaccine, because even though I was privileged to get a vaccine, but it still traumatized me for a whole year. I only got I only got stabilized at a point, after like 1 year when nothing happened. But I thought between that period and 1 year, I thought I was really going to be. I never thought I was free, even though I'd taken a vaccine. But I was really terribly scared. And what I saw, I'm not sure I want to see it anymore. Seeing somebody dying of rabies is one of the most terrible experience and most traumatic experience I've ever had.